We just want you to be one of the very first people to be aware of this fantastic innovation we are bringing into the healthcare management industry. So I'll start by introducing everyone so that I don't take your time by passing the mic along to everyone. That's why I took your name slightly. I know that I wanted to report the next 2 years. Okay, so let's start with gentlemen of the press, our esteemed guests here today, without whom we cannot do a lot of things and to whom we owe a lot of gratitude. You've been with us from day one, you've been with us in everything we do, and we appreciate you. We do not take your friendship and the things you do for us for granted. We want to thank you for taking time out of your very tight schedule to be here with us. First, I want to introduce Ms. Peace Timi. Peace is from Mekwe, one of the number one grassroots magazine in Lagos now, so to speak. The paper distributes to all the local governments in Lagos free. And so it's a grassroots publication that is making a lot of inroad in the media industry. Next to this is Ugochi Emmanuel. Ugochi Emmanuel is the convener of Tech Life with Ugo. She's one of the ladies making wave in the tech industry in that space. She recently had a conference where we got about. She does something like what you do too. She does a lot of things for the women folk in the tech space. So thank you, Ugochi, for coming. Thank you. Next to Ugochi is Eniola Daniel. Eniola is representing the Independent. The Guardian newspaper. Sorry. The Guardian newspaper. Maybe I'm projecting to the future. Maybe the next we see you would have crossed to the other side. I'll be working with Tony. You don't want his trouble. Okay. Next is Mr. Green Gabada. Mr. Green Gabada is our friend, is our brother, his son that has been there for us. We appreciate you, Mr. Green Gabada. Mr. Green Gabada works with Daily The Nation. I don't know why.
Everybody will be working with
Mr. Green Gabada works with The Nation. Next to Mr. Green Gabada is Ms. Tomi Falade. Ms. Tomi Falade works with Daily Independent. She's one of the female journalists that are quickly climbing the ladder and making their presence. Yes, she's Tomi is not easy to pin down, so we appreciate you for coming today, Tomi. And I believe that between yourself and Ugo, you guys will be doing a lot for our madam here. We'll talk about that later. And we have our senior colleague here, a veteran of many years, one of the men that always come to the media space to get things done for us. Mr. Funshawe Gundade. Mr. Funshawe Gundade is actually wearing 2 caps today. Mr. Funshawe Gundade works with PM Express and is also one of the columnists at the Sun newspaper. Thank you very much. So, like we used to say in advertising, so this is the media side. We don't want to move to the client side. So, we have Mr. Joseph Etukwedom from TeleDoc. Thank you, Mr. Joseph. We have Mr. Babaji Midawodu from TeleDoc also. Thank you. We have Apanitiat Hester. Thank you, Hester. And we have Mr. Uluwa Timilei Farinu. Thank you, Mr. Farinu. We also have Okambari Yemisi. Thank you for coming. And we have Rosemary Bembasi. Okay. Yeah. On the screen, with us in spirit, but far away from here, is Mr. David Ladio Kiwali, the co-founder of TeleDoc. He'll be talking to us about what TeleDoc is all about and how it's going to be revolutionizing the healthcare sector, not just in Nigeria but globally. You'll be giving us insights on why we're here today and what they intend to achieve with this amazing innovation. Also, because there is Mrs. Kiki Okiwale, I'm sure Madam is not straight down to all of us. She wears several hats. She's a co-founder of the Hub, and this is one woman whose zeal and restless spirit positively we can always tap from, and she's become someone that is now like an aspiration to so many young ladies out there. So today it's not about Madam Okiwale, so we'll leave that for some other time.
Yes, thank you.
Today it's about TeleDoc App, and who will be championing this innovation is Mr. Demilade Okiwale. I will hand over the mic to him now to give us his welcome address. Mr. Okiwale.
Good afternoon, everyone. It's an honor to welcome you all to the official launch of TeleDoc, streamed live across all platforms. Whether you're here in person or joining us online, we're excited to have you with us as we introduce you to our flagship product, the TeleDoc app. For those who don't know me, I'm Demilade Okiwale, the co-founder and chief technical officer of TeleDoc. While my focus is typically behind the scenes, ensuring our technology runs smoothly and securely, today I'm thrilled to share with you our vision. We all know the healthcare challenge in Nigeria we face currently, a population of 200 million people with doctor-to-patient ratio of 1 to 5,000, far below the World Health Organization's recommendation. Coupled with the fact that nearly half of our doctors are practicing abroad, our healthcare system is under immense pressure. But instead of focusing on these products, on this problem, we set out to find the solution. That's why we built TeleDoc. It's not just another health app, but a groundbreaking platform designed to make quality healthcare accessible to everyone, regardless of where they are. With TeleDoc, patients can constantly and instantly connect with top doctors, receive prescriptions, and order lab tests all from the comfort of their homes. No waiting, no long queue, no registration fee, just reliable healthcare anytime, anywhere. For healthcare professionals, TeleDoc offers a virtual office to streamline patient management. Doctors can consult, prescribe, and follow up seamlessly without being limited by location. Whether you are in Nigeria or in the diaspora, TeleDoc empowers our doctors to continue serving patients and making a real impact in people's lives. As CTO, I'm extremely proud of the secure infrastructure we've built in TeleDoc. We've designed this platform with the highest standard of data protection to ensure patient privacy and safety at all times. I would like to acknowledge the incredible team at TeleDoc for their hard work and dedication that has brought us to this moment. To the media, your support is crucial in helping us to share this story, and we are grateful for your role in amplifying our mission. This is just the beginning of our journey to revolutionize healthcare in Nigeria and beyond. Thank you very much for being part of this exciting moment, and welcome to the future of healthcare with TeleDoc. Thank you very much.
Just as a quick aspect, please, we appreciate if the presentation by Mr. Demilade Okiwale can be made available to us, please.
Okay. Yeah. All right, CTO, we're going to need your presentation so that we can share with the media team, okay?
Yeah, that's perfect.
All right, okay. So that will be me. Do you have any questions so far? Or should I go ahead and
Please go ahead.
Yes, it's very much around. So let me share a couple of information with you. And all right. All right, thank you so much, Mr. Demilade Okiwale. And I acknowledge lot of so we thank you as well for being here. I'm incredibly proud to stand before you as the CEO of a company that is about to revolutionize the way we experience healthcare, not just in Nigeria, but across the world. Our flagship product, the TeleDoc app, that millions of people in accessing timely, quality, and accessible healthcare. And to take you through why TeleDoc is not just an app, but a care movement. And even though I have this written, I just want to share pandemic, um, having family members and people the information of our clients. So this is like the third complying. And so it took us percent of the patients who have downloaded the mobile app are in the UK. It's shocking. But in the US, we've just been waiting for this app. The calls that I get every day, I hear this, how can I download, how can I do that? And the 70% have also been majorly the people consulting on the app. So we have about 20% in Nigeria, 70% in the UK, 10% US and Canada, and other part of the world as well. We've had consultation from Australia, from Dubai, from Ireland, from different part of the world. They're just so excited to be consulting with their Nigerian doctors and being able to have 24 hours. The app is always open. The doctor's times are open. You go on there, you find a doctor that is online. Lucky for us, our doctors are not just based in Nigeria. We have doctors from different parts of the world, meaning that at every point in time, there's a doctor that is available to take your virtual consultation. So we're so excited about that. So just in case you're wondering, just like so many people have asked us, why tell other telemedicine platforms out there. First and foremost, TeleDoc. All right. So the whole idea is whatever you're feeling, however you're feeling, share it with a doctor virtually. They'll help you, consult with you, give you prescriptions. It's also even more interesting when someone who has consulted comes back to share with the doctor the results of their test and they're taking it from there. It's been an amazing journey, I must say, and I know that this is just the very beginning. So first and foremost, TeleDoc is about making healthcare as hospitals. You see that between the hours of 9 to 2 or 3, all the major doctors are there. After 3, I mean, there are doctors on ground, but maybe not the doctor you want to talk to. But with virtual consultation with TeleDoc app, you can always have consultation with your favorite doctor. Biggest barriers to accessing healthcare for specialists and doctors, 20,000 naira. And I remember clearly when we were setting this course, we were make a doctor want to come on your app using their free time to do consultation. They might as well be resting. What would also help our patients, because what we're trying to do is give them accessible health, also cheaper. So you're not driving to the hospital, spending time in traffic and all of that, but also paying cheaper. So we try to compare the rates of, when you go to the hospital, how much you charge for consultation and all of that. And I can tell you that, I mean, we started, we've not had complaints about the cost because it's actually quite affordable, coupled with the fact that you're doing it from anywhere you are. Also, one of our core strengths is that TeleDoc gives users access to a wide range of specialists, including pediatricians, neurologists, fertility experts, and every field. We're open to different fields so that your kids are not feeling well. You can talk to them. You want to talk to an optician, a dentist, you can have all of that. And what this does is it saves you time. When you need to go to the hospital, after a consultation, a doctor can tell you, you know what, you need to run down to the hospital. But there's sometimes you just go to the hospital and you realize that you've just spent time and all of that when you can get the prescription you need virtually. Also, booking a consultation on TeleDoc couldn't be easier. And right here today, we're going to be showing you a demo of how to download the app, how to book a doctor, and how to have a consultation done. So we've streamlined the process into just 3 steps. Select the doctor. If every one of us can please go on our iPhone or the TeleDoc. Yeah. Some of you have it already. Awesome. Can we have it on the screen, please? So for those of us that don't have it, we are both on Android and iOS, and it's very, very seamless. All right.
Google Play Store or the Apple App Store and search for TeleDoc app. Once downloaded, you need your email, your phone number, and your KYC information. Once you've downloaded the app, load it up, click on skip, select your language, create an account, fill in your details, and submit. On submission, you get an OTP sent to your email on your way to consult with a doctor on the TeleDoc app.
All right, that was really simple, right? Yeah. And it's really, truly as simple as that. And that simplicity is so important so that everyone can have access to it. We're also going to show you how you can book your doctor. But apart from showing you how you can book your doctor, we're going to be showing you a practical demo of Mr. Gonzalo having a virtual consultation with a doctor right now, just so that you can see. And that's why you're all here. We could have just said, help us write about this, but we want you to see. We want you to be our advocate. We want you to be our mouthpiece. We want you to, tell the world that TeleDoc is here and it's here to stay. So can you play the second audio, please?
On opening the TeleDoc app, there are two ways to consult with a doctor. You can browse specialists, but you can go for the different arrays of specialists which we have. In health insurance.
At all, and it's been quite interesting to get their feedback. By showcasing the exceptional skills of Nigerian doctors on the global stage, we're encouraging patients around the world to seek treatment and consultation with specialists in Nigeria. Our platform enables this without the need for immediate travel, making the process of getting healthcare advice from Nigeria smoother and more accessible than ever before. And the next question will be why now? I mean, I shared with you earlier how long it took us to get this done. So a lot of apps actually have things like this, but they connect doctors to patients. But what we've done with our platform is your consultation is being done on the platform. So your information is secure. That is very, very important. So healthcare needs are constantly evolving, and the events of the past few years have shown us how crucial telemedicine is to the future of healthcare. People need a solution that is safe, that is secure, and that can be accessed anywhere and anytime. With TeleDoc, we've created a solution that not only meets these needs, but also addresses the unique challenges faced by Nigerians and the wider African population. Whether it's reducing the long waiting time many of us are familiar with both in Nigeria and abroad, particularly in countries like the UK NHS, or ensuring that Nigerians in the diaspora can access doctors who understand their medical history and body and structure. TeleDoc bridges that gap. At TeleDoc, innovation is at the core of everything that we do. We're constantly working to improve the platform and bring on new features. Every week, there are new features being uploaded, being updated on the app. We keep getting better. From laboratories and pharmacies to health insurance providers and caregiving agencies, we've built a platform that integrates the entire ecosystem, making healthcare more streamlined and efficient for everyone involved. As we continue to grow, our mission remains very clear to ensure that everyone has access to affordable and quality healthcare, whether they're living in Lagos or London or anywhere else in the world. We're focused on improving healthcare outcomes, reducing the burden on our doctors, and empowering our healthcare professionals with the tools they need to deliver care efficiently. We're proud of what we've built, and we're just getting started. Whether you're a patient looking for timely, expert care or a doctor looking to expand your reach, TeleDoc is here to meet your needs. I invite everyone to join us on this journey to transform healthcare. We're excited to continue innovating, expanding, and ensuring that healthcare is within reach for everyone, regardless of the location. Thank you so much for your time, and I look forward to shaping the future with you. Thank you. All right, so thank you so much for that. CTO, we're going to go ahead with the demonstration. Is it 1:30 yet? All right, so the time Mr. Gonzalo booked for the consultation is 1:30. And so we're going to have to, do we wait or can we move the time?
No, it's actually 1 p.m.
Just do other things. CTO, are you there?
Yeah, it's 1 p.m.
I can hear you.
Can you hear me now?
While we were in the middle of the presentation, Mr. Yomi Opola from Tribune Newspaper.
Good afternoon. Thank you for coming. Yes. Can you hear
Hello,
us
can you?
now?
Yeah, I can hear you. Can you hear me?
All right, can you hear us? Increase the volume. You reduce the volume.
Yes, the
Can you
booking
talk
is
now?
for 1 p.m.
Oh, the booking is for 1 p.m.
Yes, so he can join the call now.
You can join the call now. Then we'll take questions after, just so they can see. All right, can you connect, please? So what we're going to do is we're going to cast this on the screen, just so that you can see how the consultation is being done. Are you doing the video call? CTO, we're ready. All right.
Good afternoon, sir. I'm very well today. Thank you.
Is that the highest of your phone?
What did you say, sir? Okay.
Are you having difficulties?
I'm with you, sir. Yes, I can hear you. Yes, I'm with you. I've been.
So this is how you see the doctor, and you have your consultation done. So it's more or less you're right in front of each other. and you're having the consultation. Dr. Kewale, can you move to the side, please? We can barely see your face. Yes, we can see you better. All right, so this is how the consultation is done. Once the time for your consultation, so its timing was for 1 p.m., but because we're still within the window of 1 to 1:30, that's why he's able to join. Once it's past 1:30, he can't join anymore, so they will need to reschedule the meeting. Also, once the time is done, automatically the call ends, but it shows the patient and the doctor, you have 10 seconds more, you have 9 seconds more, so there's a countdown. So you were not just cut off abruptly. And if there's anything you want to say quickly, you can say, doctor, you know what, I'll reschedule, I'll rebook another session. But most times, 30 minutes is enough, really. I mean, we've had people rebook, maybe because they want someone else to join the consultation, but not because of time constraints. So,
okay. So thank you, sir. I have stomach warriors. So we just want to test run this and let our people in the media see how this works. You know, they've been a part of the journey from inception to now. Okay, that they are the first people who are sharing this. They are the ones that we, our voice are here out there, so we get feedback from them, and then they can also go out there and help us talk about this and give it the desired mileage we are hoping we will get with this wonderful innovation, sir.
Yeah, thank you so much. So basically what happened is quite a lot of innovations before this talk. Immediately a lot of things like especially one all that have happened. TeleDoc. And my client is 6:30. Sometimes I get 3 bookings, sometimes for 8 hours. And it is quite different from we talk to each other and get them out. Like blood line, need medication, right? Yes, so there. We want to Nigeria, you know, if they can, if I think what I'm consulting about more than this advice and there is quite a lot of experience that we I want to know like this. You've never been that. So putting from other the last assessment had from Australia.
Australia, wow.
Thank you so much, Dr. Kewale. Thank you so much for your time. We can end the corner. Thank you. Bye. Thank you. All right. So when can you leave that on the screen, please? So when you're done with your consultation, what you do next is you can rate the doctor. You can rate the doctor after the consultation. If you have any complaints or you feel like you didn't get value, or you feel like maybe you don't want to consult with that doctor, you can put the feedback right there. After rating, you can put the feedback. So this also helps us. For example, if we have 3-4 people giving the doctor zero feedback, then we begin to ask ourselves what is going on. And so we have the ability to go back, ask questions. The patients, we call them, Esther is the customer care person. She calls if they're having any difficulty or they booked a booking for one, they can no longer make it. It's fine, their money is not lost. They can rebook the session. But once a doctor is seated, you didn't cancel your booking, you didn't do anything, and the doctor sits through the time waiting for you, then your money cannot be refunded because the doctor's time has also been spent, and I think that's fair. So you can give us feedback, you can tell us, I don't want to use this doctor anymore. And if you have a lot of complaints, then we remove the doctor from the app. Yeah. And so that's been we haven't had any complaints so far, to God be the glory. It's been really amazing. But we know that over time, the more people we have on the app, every now and then, like anything in the world, we're going to have our own challenges, but we're always on top of it. And the CTO is always making sure that, we're taking feedback and review as fast as possible and working on it. So I'll take questions now. Okay, there's another one. You can hold that. Can the CTO hear us?
Yes.
Yes, I can hear.
All right, thank you.
No, you can sit, please.
Yes, you can sit.
Okay. Thank you very much for this opportunity. My name is Ugochi Emmanuel, and as is earlier said, I report for Tech Life. Okay, let me first start by saying congratulating you for this awesome innovation. This is a great invention for us in general, because I presume a lot of us want this. I don't want to talk for every other person. I presume a lot of us want this, and it's going to be a very good one, a very good idea for us. Because obviously, most of us rarely have the time to want to go sit down with a doctor when we have other things we need to attend to. Going forward, you mentioned something about 3 apps that you have built. You didn't mention the apps.
Oh, it's all on TeleDoc. It's just because maybe within the features they have does not align with what we want to do. So we have to scrap that and then try another one until we found the company that built this in the UK with the CTO. And so what we tried to do initially was look inwards, and we tried 2 companies in Nigeria, to do this, but they weren't giving us the kind of features that we really wanted. And so we looked for a company that has a plug and play system, and then we can now add all the other features that we want. And so far, it's been amazing. So it's still on TeleDoc. It's just that, we keep, if iOS does not approve it or Android does not approve it, we try to see what the issue is, and then we try and rework on it.
Okay, thank you very much for that. Okay, considering the cooling economy, and of course, the inflation in all commodities, internet facilities inclusive, how do you intend to make your gain, your profits? And then are you also putting into consideration the underdeveloped areas? Because it's not everyone that has this Android, it's not everyone that has an iPhone, and the underdeveloped areas may not be internet savvy. So what are you guys looking at? And then allow me to also ask you how accessible TeleDoc is. All of these, of course, someone's up into this internet, our data facilities in Nigeria. We all know that technology has not is not full. It's not like the UK, it's not like the outside world. We are still trying to be better than we are yet. So how accessible is TeleDoc to other areas?
Okay. CTO, do you want to take that?
Yep. Thank you very much for that question. In terms of accessibility, the TeleDoc app can be downloaded from any country in the world. It's available 24/7. We've built it in such a way that the data, the information you require can be accessed at any time. We also built it in such a way that the integrity of the data is intact, so you can be sure that the information you're getting is the right one. And also, we built it with the confidentiality of the patients involved as well. Regarding the rural areas, the first step for the company was to actually have a market-ready product to show that we can do what we actually want to do. Now that we have passed that phase, we would be looking towards assistance and partnerships going forward in order to be able to get these platforms to rural areas where there is little or no access to medical facilities, also bridging the gap for them as well. Thank you.
All right, thank you very much. Like we all know, just still on your question of the internet and all, honestly, it's not just a TeleDoc issue. It's a Nigeria issue.
Yeah.
Right now, some some cities or some towns, small villages don't even have the mast for them to even have. So there is really nothing we can do than work with, the telecommunications company. And also what we've had some people, and I remember somebody consulting and saying, the next booking they did was to go to where their aged mom is to make sure that, because even if they have the phone and the internet, it's still an issue for them to download and do all of those things. And so sometimes you might need a more experienced person to put you in contact with that person. So one of the things we'll also try to do over time, is part of the things we're working on, is to be able to link a two-way call where you can call whoever you want to have the consultation. You as a person that is IT savvy can call that person, and then we can link the call. We haven't added that feature. Like the CTO said, we've passed this phase. We're happy with what we have, and then we'll now start looking at how to, make sure we carry everybody along.
Okay, good morning, everybody. Madam Gamana from the Nation. So my question is in two phases. One, the doctors. How do you source the doctors? Because I know you said they are scattered all around the world. How do you source for the doctor and to be sure that they are competent enough, to deal with different clients? That is one. Then two, in occasions where you have prescriptions that has to do with probably injection, how does the patient do that? Maybe whatever it is I've spoken to the doctor about would require me getting an injection and something while I'm still at home. How do you intend to solve that? Thank you.
CTO?
Yeah, thank you very much for that question. Can you hear me?
We can hear you now.
Okay, perfect. So for the first question regarding how we source doctors, we welcome every type of doctor and every specialty of doctor onto the platform. When the doctor signs up, you fill in your KYC documents, and then we require you submit your passport data page, your highest medical certificate, and also your renewal license or medical certificate. Now, what happens is when a doctor has signed up with their KYC and provided all these documents, it goes through a robust approval team, which they then grade you on your fees based on your years of experience and other factors. So at that point, we verify that that medical certificate is actually legit. We verify that you are who you say you are as well before we approve you to be on the platform. We also have the compliance team, which reaches out to the doctors to ensure that if anybody's medical or renewal license expires, we have the up-to-date version. And pending while we get that version, we will take you off the platform, pending when we can get that. Regarding the second question, if you can just
How do we get patients?
okay, so
No,
yeah, thank you very much. So once the consultation is done, the doctor is prompted on his end to fill in a summary. And in that summary, you can actually add prescriptions. You can forward those prescriptions to pharmacies on our platform. So the nearest pharmacy to you, it can be forwarded and you just go there and pick it up. You can also be prompted by the doctor to perform some lab tests. Any of this, the prescription, the lab test, you will be able to access it from your own app. And once you have that, you can download it on your phone. You can take it to the neighboring pharmacy and get that done. You can also use that to go to a hospital and speak to a doctor. Should it be a situation where you're trying to get something that cannot be gotten over the counter, and the doctor will be able to guide you forward. So each prescription sheet comes with the signature of the doctor as well, and the doctor can be contacted to verify that that prescription is valid. Thank you.
Thank you so much, CTO. Just to add to that, how do we get our patients? So far, we've reached out to using social media platforms to reach out to people with recorded video content to show them what the app can do. However, that's why we really want to partner with the media, because we know that, there's only so much we can do. When people hear from you, the expert, and you're saying that, you've seen this, and that's why we want you to see how it works. We've seen this, we've seen how it works. This is legit, this is real, this works, and then people go ahead and download. So we have a different, like you have seen, we have an Android, we have an iOS. We share the link with those that we know. For those we don't know, we just tell them go on the TeleDoc app. All the information we're putting content out, running sponsored ad, just so that people can see it. However, we don't want to do a lot yet until the media gives us their backing. Because then if people go ahead and research, who is TeleDoc? What's TeleDoc? Are they legit? Are they real? We want them to know that, there are people who have seen us and people who can actually stand. And we're not just talking about user-generated content that can be generated anyway. We're talking about the media saying that, we give them our backing and we've seen what they're doing. And that's what we've done so far. But after this Hangouts launch, we want to make sure that, we now start full force. Like I said, after this meeting is when we're launching. We haven't really launched to the public. So this is our launch.
Good afternoon. Good afternoon. My name is Faradi. I have 3 questions, 4. Please allow me to go back to what he said earlier on what Mr. Dr. I'm not sure if it's not a doctor. Okay. So what Mr. said on the patient confidentiality. Okay. So I understand that because this is on social media, there's a not social media, means via video or audio, however the consultation happens. I saw that when I tried to book a doctor, I could select video. And so if something like that happens on video, is it recorded? And then how do you ensure that the details of the consultation does not because it's possible that it's recorded for quality control purposes. So that's understandable. But how do you ensure that data does not find its way to the public? Because people are pretty sensitive to that kind of thing. That's one. Then 2, are there emergency provisions on the app? For example, you have a consultation and you understand that maybe the doctor says that situation is something that needs emergency, the person needs to get to the hospital immediately, or the person is unable to get to the hospital. Are there provisions for that you can just book an emergency service that takes you out of the place that you are to the hospital? And then can 2 people, for example, use the same session? For example, the mother has twins or 2 children at home, and she's booked a session with the doctor, and she wants the doctor to attend to 2 children. Is it possible? Is there allowed to start with? And then is there a way you regulate doctor times, for example? We see that sometimes people are overworked. I'm just going to make it a little informal. For example, you see Uber drivers who are tired and they are still driving. I've had an Uber driver fall asleep on me before. I was so afraid. I asked him to then come and drive. I want to get to the station and give him his car back. So that kind of thing, if the doctor is tired, of course, you ensure that you cannot get the best from that doctor. So is there like is there a way you calculate it to ensure that people don't spend too much time on the app, that they are now tired? After a 30-minute consultation, you take another 30 minutes, take another 30 minutes. Of course, you are human. So basically, that's it. Sorry, I took all.
No, I mean these are very, very valid questions. CTO, did you get the 4 questions?
Yes, I did hear it. At some point, I might ask if you might repeat 1 or 2. But let me go for the first question, which has to do with the video and recording. So yes, you're right. We do record the video for quality assurance in case of any scenarios, but we do also have a retention period of 30 days. After 30 days, that video is automatically deleted off our servers. The reason for this is to ensure that the patients and also the doctors have some trust in us should any situation arise. Also, every information that is being sent across the app is being encrypted. So should there be any access on intruded access, they would not be able to unencrypt our information. Also, just to points, we also, as our team, the technical team, we are actively always scanning the system for vulnerabilities, and immediately we discover any vulnerability, we try to mitigate it as soon as possible. So to answer that question, yes, we do record for quality assurance, but it cannot. We have the highest level of security and the least privilege in place for people that can access that information. For the second question, which had to do with if it's an emergency situation, so what would happen is, ideally, if you speak to a doctor on the app and you need to speak to a hospital, we also have hospitals available on the platform as stakeholders as well. So you can literally book an in-clinic session, which means that you've already booked a time frame that you want to be at the hospital. So if I book for 12:30 to 1, when I get to the hospital, I'm not waiting to speak to anyone. I'm going straight to the hospital. In terms of emergency, our future plan is to be able to integrate ambulance services also into the platform. So at some point, someone can actually request for an ambulance should it be an urgent situation. In terms of the burnout of the doctors, every session that occurs, we prompt and ensure that the users give us a rating and a feedback of the doctors. Should the users not do this on the in-app process, our customer service team reaches out to every patient that consults on the platform to get a feedback on how the session was. We use this feedback to, one, to appraise the doctors, to know that they are performing and providing proper care to their patients, and also to, as a form of recognition to our doctors. So the doctors that are putting in effort, we also have to give them their flowers as well. I know there was one more question, but can you help me with that? Thank you.
Can two people consult during the time? Can they have a family consultation? Like I have two children and I'm talking to a pediatrician. Can I consult for two children at the same time?
Okay, so in terms of consulting for two children at the same time, we currently do not have that capability. In the future, we're looking at integrating that into the system. Currently, what we have on the platform is I personally can book a session for somebody else. And what would happen is, let's say I book a session for my mom, for instance, I put her email address, her information, book the session. My mom's email will be prompted with a link to download the app to have that session. Because we are trying to ensure that the confidentiality of the patient is being respected, we wouldn't just allow anybody to have a session on behalf of somebody, because at the end of the day, it's their health, it's their medical records as well. Thank you.
All right. You talked about regulating doctor time.
Yes.
You already you addressed that. So you addressed all your four. Yeah. All right. You have another question. Oh, no. Please go ahead.
I see that you're big on mental health and physical health, of course. Are there provisions for like physiotherapists and all those all the other assistance units of medicine?
All right. Okay. Before he takes that, I'll just say that no, please don't be sorry. That's why we're here. So before I'll let the CTO take that, I'll just say that a few days ago I started this virtual fitness with a lady that I met, and she said, you know what, we'll just do 20 minutes virtually, and it's been amazing. I mean, I'm not a gym person. They've taken my money too many times and I never go. And you know, I was just talking to her about the fact that you can actually have consultations with people, and immediately she signed up. She's so excited about that. She has people in different part of the world that would want to have this session. Sometimes, you know, you're doing it online, they don't make payments, you know, and you don't want to cut them off. But once you are on a system that works, and then before they go ahead and even have their fitness done, their payment is done. So I believe that that's one really big thing we would be looking at. However, CTO, do we have physiotherapists and all of that yet?
Currently, we have we focus also on mental health, like you mentioned. We have counselors, depression specialists on the platform as well. We believe that mental health is a very key thing that we should all consider as well in Nigeria, even though most people have not been informed up to that information. But mental health is something that we value. We're looking to onboard physiotherapists onto the platform. We're looking to onboard all fields of medicine, including dietitian, people who need to speak to somebody about their diets, how it's going. We're looking to onboard them and have more of the stakeholders on the platform. Thank you.
Thank you so much. So we're open to various specialty, really. Like we said, we haven't really started pushing, and we already have over 100 doctors. But for all the other field, what we want to make sure we do is fill every specialty that we have on the app. So that's part of the things we're working on. Any other follow-up?
No.
Okay. All right. Thank you, sir.
Yeah. Let me say, really want to thank you. Not even saying congratulations. I really want to thank the QR. Let me use that word. I've seen about 6 or 7 telemedicine apps, but to be honest, probably most people, I never pay attention to it until today. And there are a lot of things that while Mr. Kiwale was speaking, and when you had a lot to yourself, I had a lot of information about telemedicine and its importance. So I really want to thank you for even bringing it up again, and I hope more Nigerians will be aware of this particular app. Let me say, I also have like 3 questions.
Okay, sir.
One of the questions I've been asked by Bigger, but let me also expand on, maybe Mr. Kiwale or yourself could expand on it. It's about the feedback after consultation and prescriptions. Are there any follow-up to take for example, like you come to another hospital, there is a medical record. After maybe the first session, maybe you need the follow-up to what you've already discussed with the doctor previously. Are there any medical records set aside for you for the doctor to know exactly what exactly the problem was
and the feedback,
especially when you now had to, maybe the first doctor you spoke to wasn't around for the proper section, and another person will need to take it up from there. Are there medical records for those feedbacks? Then secondly, within the few minutes that I spent there, I've also tried to look around the app.
Okay.
I could only see about 6 medical facilities on the app. St. Ives, Pylon, and about 3 or 4 other ones.
You mean hospitals?
Hospitals. Are there plans to bring in more hospitals, given the fact that perceptions of people, let me say my own perception, and which probably might be perception of other people, those 6 facilities are a bit elitist, so to speak. Let's be honest, it's so elitist. So are there plans to also bring in some facilities for people like us who live in the better areas? Today's umbrella is still for big people. Are you sure?
Yeah, which addresses what you were talking about earlier, about even the rural.
Are you sure?
Yes. I don't know.
Don't compare us with guys like this guy who lives in Miami.
I don't know if we have places like some villages in Ajabati. You know that name now sounds it. What are you guys doing about?
I understand though. There are increasing numbers of middle class, up to middle class people around that, but notwithstanding, we know ourselves. Then the last one, please. The reference to some pharmacies. Are there any plans to also expand the numbers of the hospitals and then pharmacy? And can I also take prescription to any other places aside the recommended ones? Thank you.
CTO, would you take that?
Yes, I would. So I'll start from the last question and work my way back. Regarding the prescriptions and pharmacies, so ideally, a pharmacy is one of the key stakeholders in this platform. So when a pharmacy gets onboarded, they have their own portal where they can log in from. Now, when a prescription has been prescribed to a pharmacy, it automatically sends it to the pharmacy. So the pharmacy would be waiting for you for when you're ready to pick it up. Should you not want to use that pharmacy, you can also go directly onto the app and download your prescription. You can then take that prescription to any pharmacy. As long as it's an over-the-counter kind of drug, you can receive it. But should it not be an over-the-counter kind of drug, you would need to go to a hospital, or they would need to contact our in-house team to verify that prescription, just to ensure that we don't have situations of people issuing prescriptions for no reason. Regarding the second question, which is the hospitals, one of the key things we did in the beginning when we started was we were trying to get as much users and stakeholders onto the platform so we could have some tests done, ensure that we're actually on the right path. And in the process of that, we approached the Guild of Medical Association, medical directors, and they were grateful to accept us and test our platform, run with us, and they have been working with us throughout this process to ensure the stability. So most of those hospitals you've seen on the platform are members of the Guild of the Medical Directors. But in the future, we're looking to also onboard as many hospitals, put as many stakeholders that can work with the range of the people, the clients that we're looking to serve. Now, we also know that we're trying to project an affordable healthcare system. So we have to make sure that our pricing is equivalent to something that's affordable. So the highest ranked doctor on our platform earns 20,000, while the lowest ranked doctor earns 10,000. That is just to put it into perspective of the affordability. Each session is 30 minutes. So you have that 30 minutes to discuss as much as possible with the doctor. The first question which you asked, you have to help me with that once again.
The medical records.
The medical records, perfect. So every time you consult on the platform, you're basically creating a digital medical record. Now, what happens with that digital medical record is, should I choose to speak to another doctor from the doctor I've spoken to, the doctor would request for access to be able to see your previous medical history. Now, you have to grant access to that doctor before he can see any information from you apart from your name and what you're trying to book for. Things like that is very key. Now, also, should you have a situation where you've done an external test or an external lab and there's a result you want the doctor to also see, on the app platform, we have a section called medical reports where you basically upload that record into the system and you select the doctor out of the list of doctors on your list for who you want to share that record with. Now, after a certain period of time, the app will prompt you if you still want to renew that connection of that doctor being able to view your medical record. I hope I've been able to answer that question.
Okay, she has a follow-up question to
Yep.
that question.
I just want clarification.
She wants a clarification.
Okay,
Yep.
so you said that you need to grant access to the medical record. So
Yep.
what I'm asking is that during your first consultation, is there somebody that will transcribe what the doctor has said, or is the doctor going to take notes, or is the next doctor going to have to watch the video of what you're? Is it
No, okay, so I'll take that to explain it. Once you have your consultation done, the doctor, after the consultation is done, gives a report.
Okay.
This report comes to your email, right? And it's also by the side of your when you log in. So the information that you shared with the doctor and his own feedback, he gave you this advice, this is what you're feeling. He has asked you to go do this test. He has told you to visit the hospital, for example, all of that. If they want to rebook another consultation and you give that, then the report of the other doctor can be read as a follow-up. Does that explain it? All right. Okay.
Sorry, are you bringing in some HMOs?
Okay. Yes. CTO is asking, are we bringing in HMOs, emergency care, more hospital, and more pharmacies onto the platform? Over to you. Thank you.
So yes, we have a section also created for health insurance, which we will be onboarding both health insurance, HMO schemes onto there. We want to ensure that the app is a complete healthcare platform that can do anything you want to do. That is the long-term vision of the app. So we will keep innovating. We will keep bringing on more stakeholders to achieve that goal. Thank
All
you.
right, thank you. We have a question online, and the question says that the timing season in the app is on. It's usually midnight of my time. In situation like this, what can I do? So I believe the person's time zone is totally different. And the person is saying the doctors they would want to consult with don't open their times at that period. Over to you. Thank you.
Okay. So one of the amazing features which the app has is the app automatically detects your time zone. So when you sign up for the app, it would, whether you're in America, Australia, anywhere, it will automatically detect your time zone. And what it will then do is it would convert the doctor's time zone to your time zone. So should you go on the app now and you're based in America, and it's showing 2 o'clock your time, that is actually 8 o'clock in the doctor's time. But as long as there is a slot open for that doctor, it will calculate it with the time zone to show you the exact time at your own time, which is the patient. So yeah, thank you.
All right, thank you very much. Do we have more questions? We have more questions. Okay.
Good afternoon, Popola.
Good afternoon, sir. We can hear you.
Okay, so my question is on the consultation level.
Can you hear him? CTO?
Yes, I can hear him perfectly.
Okay.
So you mentioned about the prices ranging from 10,000 to 20,000. So what determines which doctor I'm going to talk to, or who determines it? So to be able to know that, okay, yeah, so I'm talking to this doctor and I'm paying this particular amount, or this is the doctor. So who or what determines the consultation price and which of the doctors I have to?
Okay, well, so far, you decide the doctor you want to talk to. We've had some patients who are already familiar with a particular hospital. As a matter of fact, they're already familiar with the doctor. They just want to have their consultation done. So they know who they want to consult with. We also have situations of people just coming on the app. I am just looking for a pediatrician. Now, I don't know any pediatrician. You see the list of the pediatrician, you see the rating. For somebody that has a 5-star, I mean, automatically your head just tells you, oh, this person, that's just the way it works. However, so you decide and you see the price right before you book because your money needs to be in your wallet for you to do your booking or pay through the pay stack. So it tells you this doctor is 20,000, it tells you this doctor is 10,000, and you decide who you want to consult with. None of us have the power to tell you. So we're just a middleman. We're not medical doctors, as you know. We're just we're tech company that is trying to bridge the gap between the doctors and the patients. Did I get that with you?
Yes, 100. That was very
All right.
correct.
All right.
Okay, there's a question I want to ask that seems to have escaped us.
Okay.
How do I put money in my wallet?
Okay. CTO, how do you put money in your wallet?
Okay, so we integrated, basically there are three platforms, three ways you can pay for your consultation. The first one is funding your wallet. The second is through Paystack, and the third is Stripe. Now, Paystack is generally for Nigerian-based cards, where you can pay by card, pay by transfer, pay by bank, and all those other features. Whereas Stripe is for the international community as a payment platform. Now, you can fund your wallet either using Paystack or using Stripe before the consultation, or you can pay directly straight from Paystack or from Stripe. Thank you.
Did that answer the question?
Yes.
All right. Another question.
While you were presenting, you made mention security, that TeleDoc is secure.
Absolutely.
Every day, cybercrime increases. How secure is TeleDoc?
CTO?
Yeah, thank you very much for that question. The foundation of our security strategy at TeleDoc is using the CIA triad. For those who don't know what the CIA triad is, that's confidentiality, integrity, and availability. Confidentiality is one of the key factors because all communications between the doctor and the patient are protected to ensure that sensitive health data remains private. Our data integrity is also equally important. We've put measures onto the platform to ensure that consultation summary, your prescription, your lab orders remains accurate and cannot be altered to ensure that you are getting the exact information which your doctor is given. And also, healthcare doesn't wait, neither should the patient. So availability is extremely key for us in our infrastructure. We've built a system that ensures that the platform remains 24/7, enabling doctors and users to connect without unnecessary downtime. Now, aside this, we constantly, on a daily basis and weekly basis, we run vulnerability scans on the system to ensure that every vulnerability that has been detected is being mitigated or it's being handled immediately. Our platform ensures that patient records are only accessible to patients and healthcare providers because we take data privacy also very, very important to us. We are in compliance with the global privacy standards as well. Aside that, we've created a platform that allows patients to receive medical care with confidence, knowing that their personal information is safeguarded, and the trust is central to our mission to making sure that healthcare is more accessible, secure, and reliable for all. Thank you.
Thank you very much. Any more questions, please? We're good. Thank you. Okay. Mr. Gazan. All right. Is there anything else you want to share with us, CTO? You're muted.
Apologies for that. I just wanted to thank everyone and also point out one other key factor that we must have skipped as well. So when I mentioned earlier on that the highest price doctor is 20,000 and the lowest is 10,000, another key thing that we have is if you, for instance, spoke to a doctor today and you paid 20,000 today, should you want to follow up with that doctor, you wouldn't actually pay 20,000. It will be reduced. So the follow-up price is always lower than the original first-time booking. That's just to ensure that there's a continuity of care with the patient as well. Thank you very much.
Yeah, thank you so much for that. It actually skipped my mind as well. I was going to say that once you have the consultation done, the next consultation you're having, if your doctor is 20,000 and you're having a repeat, it becomes 15,000. Yeah, going forward, it becomes cheaper. Also, if you want to have a meeting, for example, you do your consultation today, you're supposed to meet your doctor again, and you pay 15, and it takes about maybe 3 months for you to come back. So there's a timeline that the payment becomes 15,000. After a while, it's no longer a follow-up. So we leave it as a follow-up option for 1 month because you might need to get some tests done. But if it's no longer a follow-up, the money comes back to the actual price. I see you have another question.
You already answered.
Oh, you're going to ask that?
But so far, we've seen some consultants and all, but there's no gynecologist.
Oh, there is. Lots of them actually. The doctor that he consulted with, yeah, the doctor he consulted with is the gynecologist.
But all your doctors are 5-star.
No. There's some that are, yeah. No, it's not. Maybe those are the ones that have been consulted with. Yesterday we still onboarded new doctors. If they don't have the consultation done, they don't get that stuff. Yeah, so, and you did mention, somebody mentioned earlier, we definitely want to make sure that we get more patients on the app and have more doctors on the app as well. We're seeing that. All right, so we have another question, and I'm glad that people online are actually asking this question. The last question, how about the app privacy policies? I mean, sharing our private documents and information out there on the app. How about our privacy? All right, so I'll let you take that. Is the app encrypted. So I guess the person just joined. I know we already answered that question about twice. But CTO, I'll just let you answer it again because these are the patients and they're asking real life questions. Thank you.
Okay, thank you very much for that question. In terms of the privacy policy, we adhere to the global privacy standards. We have a period for which we use your data for. What we use your data for, we also document it in our app privacy, which can be found on the app. Um, in terms of your prescription, the app is end-to-end encrypted, ensuring that every information that is being sent from the client side also to the doctor's side is encrypted and decrypted at the other end. Apart from that, we also ensure that all records that are being sent, all information is being encrypted in the back end in the database as well. So should any situation come up, any intruder would not be able to decrypt our information as well. Um, in terms of I'm just trying to refresh on the information. Okay, in terms of how the app works as well, we the video call section has encryption as well that sends the data for your video files across each other to ensure that no interference can actually come in. And we have systems also in place to ensure that we are monitoring the access to every video call session. So yes, the app is 100% end-to-end encrypted.
All right, thank you so much. I hope that answered your question. Thank you for dropping your questions. You can still drop your questions if you have any. Thank you. Um, I think that's about it, right? Let's see.
So good afternoon again, everybody.
Good afternoon.
I want to thank you for joining us for this session. We really appreciate you. So while we're in the middle of it, Mr. Yobamiladipo of Posh Classic came in.
Okay. Hello, thank you for being here.
Yeah. So our media friends, gentlemen of the press, because there are no ladies in the press. Is that not what they call people?
That's what they used to say.
No, it is that's changed.
Rafting.
Okay, what the gentlemen and ladies. Okay. So thank you very much for this session. I believe the session has been quite insightful and educative, so to speak. At least we know that from Nigeria to the world, we're bringing something that can shape healthcare delivery, and we're saying these are doctors without barriers or walls. Wherever you are in the world, you can actually talk to your favorite doctor. So you do not have the headache of saying, okay, I'm leaving Nigeria, Dr. Okiwale is my gynae, and I'm jumping out to UK or Canada, anywhere. How do I now seek my new doctor with my medical history and all that? It's all been taken care of with this app that's been introduced by the Okiwales. Thank you very much. Like I said earlier, the focus of this meeting is the TeleDoc app and Mr. Demilade Okiwale, the CTO and co-founder. So thank you, everybody. As we go along in this wonderful journey of making this app a global asset to everyone out there, we will be banking on your support and your friendship as stakeholders, because I believe our media friends are stakeholders also. Absolutely. In this wonderful journey. Thank you, and God bless you. Thank you very much.
All right, thank you. Just before we go, it was asking the question. It doesn't want me to ask the question. I'll ask the question on his behalf. CTO, he asked me a very valid question, which is why is the charges not on a monthly basis? Why not monthly or quarterly or yearly? Why is it per consultation? So I'd want for you to take that. Thank you.
Thank you very much for that question. One of the key things which we wanted to ensure is that our doctors on the platform are compensated for their time. And one of factors involved with that monthly or quarterly payments is the doctor doesn't actually get the real value of that session, that 30 minutes he has just spent. So what we've done is we've put it there in a way that you can access the health at any time you want, any healthcare you need at any time you want. You pay for it now and you get what you want instantly. We don't want you to pay for the whole year and then the doctor is in a situation where he doesn't know if he's getting bookings. We want the doctors to know that people are out there looking for them. People want to speak to them. People want them to give them care, basically. So that's why we made it a pay instantly in that moment for it. Thank you very much.
All right, thank you. One of the reasons is because most of the apps that do the monthly one, sometimes you don't even get to use, you don't even get to do the consultation. You pay for a month or three, and in 3 months you're okay. I mean, you don't go call a doctor if you don't need it. And so what we have done is, and most of the telemedicine app that does monthly, what they do is they refer you to a doctor. They don't get the consultation done on the app. So all of these features that have been added to our app is to make sure that everybody, both the patients and the doctor, gets value for their time. Thank you. Okay, so let me get your food. I will be right back. If you have more questions, please feel free. You have over, so you have enough. Okay. CTO, we're going to let you go. You can give your. Okay, I think you've done that, right?
Yes, I have.
All right, so we're going to let you go. Thank you so much for your time.
No problem.
Let's shape the world together. Bye.
Thank you. Bye.
Bye.
Yes.